Hello, my name is Chantel Lacey. I'm going to be doing a education session with my patient. His name is John. He is currently in the hospital. So we're getting ready to enter the room, and I'm going to introduce myself and let him know what I'm here to do and also perform hand hygiene. Okay, knock on the door. Hi, John. My name is Chantel. I'm your student nurse for today, and I'm here to give you some education on pressure injuries and the rationales behind those and why it is important to prevent any skin breakdown or damage for long-term health as well as your current stay in the hospital. So to get started, I'm going to educate you on the 4 stages of pressure injuries and what they look like, the colors, and the depth. Um, and to let you know that if you feel any pain or anything, that it's always good to let the nurse know. So stage 1 is a non-blanchable stage. It's red. It can have changes in sensation and temperature. It can appear on bony promises of the body, and the skin is intact. So that's stage 1. Stage 2 is a partial thickness injury to the skin, and you have exposed dermis that can be pink or red. It'll have moist, it can be intact skin, and it can appear as a blister, and it can have pain associated with it. The 3rd stage of pressure injuries is a full thickness stage with skin loss. You have exposed adipose tissue or fat tissue that exposed. You can have soft or eschar visibility. The corners can be, the edges of the injury can be rounded. It can have tunneling may occur, and it can be painful, uncomfortable. Stage 4 is your full thickness with skin and tissue loss. You have exposure of muscles, tendons, ligaments, cartilage, even bone. You will have some slough and eschar present. It can be very painful. You can have tunneling around the injury, the skin where the skin is not intact. And the next one that we would have is the unstageable injury, and it can be obscured by full thickness, loss of tissue on the skin, and it's sometimes not visible. It's that to the depth of the skin. I mean, how deep it goes. So it's very important that we always keep an eye on your skin, no matter what stage of a pressure injury that may be happening at the time. We have a deep tissue injury that's non-blanchable. It can appear red, maroon, or purple in discoloration. The skin can be intact or not intact. It also can be accompanied by pain, temperature, and changes of the skin. So those are the stages of the skin of pressure injuries. It's very important that we try to limit any pressure injury occurring with our stay here today, John. So before I move on to how can we prevent these stage injuries, do you have any questions about the stage injuries that you need clarification on? Okay, so with that being said, I'm going to tell you why ways to prevent your pressure injuries from occurring, and that's by being mobile, by staying mobile and changing positions in the bed as often as you can, repositioning your weight, distributing your weight on how long you're laying on that tissue and having it be exposed to pressure. So basically, we can do Q2 turns every 2 hours. We can even move from the bed to the chair, and you sit up in the chair for an hour or so. Keeping your head no more than 30 degrees when you're in the bed. Also, we can elevate your legs up in the chair with the reclining position. And we can use positioning devices such as wedges, pillows, that also helps keep pressure off of your bony promises, you know, any exposed skin. And then we can also use specialty beds that have like fluctuation, like with the air, and some have sand in the mattresses. So whatever would fit your intervention at that time. If anything like a ulcer, or sorry, pressure injury should occur, we can always adjust our devices or medical devices to help with healing. But we're going to first try to prevent them altogether and keep you mobile and walking you in the hall, and keeping your skin intact, keeping it dry, keeping it away from moisture, making sure it's cleansed, that there's no, you know, any bacteria, fecal matter, urine, or what have you on your skin, keeping it nice and clean and dry. Um, and making sure that your gowns and any dry dry devices that we use, like the chuck pads, are not bunched up underneath you, that you don't have anything that could have fallen into the bed from, when you're eating, that your linen and stuff is nice and straight to keep you comfortable. With that being said, we will also make sure that you have your appropriate intake of nutrition and keeping you hydrated, so that your tissue in your skin is stays intact. So getting the right diet regimen in, and your vitamins and your essential nutrients, fiber intake, and all that good stuff is very important. Um, Prevention of pressure injuries are very, very important, because they can lead to other things occurring in the body, such as sepsis. And then, you know, you can have existing conditions that can contribute to your pressure injuries occurring. So we're going to try to prevent all that from happening while you're here with us for your short visit in the hospital. With that being said, I'm going to leave you some extra information on pressure injuries and ways to prevent them. And if you have any questions, do not feel free to push the nurse call light, and someone will be in here to help you answer anything, even if you need assistance turning and repositioning the bed using the position devices, or going for a walk to make sure that you're safe and steady on your feet. So it was nice meeting you today, and I will be seeing you later on for your med pass. And if you need anything before then, please do not hesitate to call out and ask for me, and I can come in and answer any questions that you may have. So thank you, and I will see you later, and have a good day. All right, that's the end of my patient education with Mr. John. So looking, back for my critique to see how I did, I tried to remember everything. So thank you guys and see you on Friday.